Reduced tremors. So I travel all over the world. I see people all the time. I meet new people all the time. And a lot of times, everywhere I go, every time I teach, there's always somebody or many people usually with Parkinson's. So I might see somebody come in. They got one side, could be bilateral. So what we do is just this. I'll show them, say, hey, how are you? Nice to meet you. I noticed you have a tremor. Can we do an experiment? And then just turn it on, put it on low speed in their hands, and have them you want complete contact with the palm skin and fingertips. All right, now if they can tolerate it, we'll go to the medium. And a lot of times we'll do the medium speed. I'll talk for a minute. I walk around, meet other people. I remember in Mexico City at one point here a little while back, the gentleman who I gave this to first, I walked around because there were about 400 people at this presentation. A lot of people with Parkinson's, a couple hundred. And then I come back around about 5-6 minutes later. He had already given it to somebody who has a tremor. And he went from like this, bilateral, to nothing. Now, with that said, we have to realize that, again, not everything works for everybody all the time. However, usually the tremors will diminish. It doesn't mean they'll go away totally. For him, they were completely gone, and that happens quite often. But that might last 5 minutes. It might last 2 hours. Okay? I had another gentleman in a different city in Mexico who held on about 10 minutes. He had 5 minutes of still, and then they came back a little bit. So he held it for about a half an hour. And then he didn't tremor for about 2 hours. So here's the reason that's important. It's a temporary relief to a tremor. And for many people, we learned earlier in the program that the tremor can be debilitating. Well, not debilitating. It's the least debilitating, so I stand corrected. The tremor can be the thing that may cause them to not go somewhere because, like a social gathering or out to dinner, because spilling food, spilling a drink, right? Maybe on themselves or on the table or even on somebody else, okay? So the tremor, to clarify, I just want to clarify what I just kind of misspoke there. That is, as you already know this, we went over it. It's the least debilitating of all the motor symptoms, okay? It's the most visible, but it's the least debilitating. So this can be a temporary reduction before they start to do fine motor skills, things like buttoning, zipper, brush the teeth, do the hair, shave, cut vegetables, cut something in the kitchen, like they're cooking or something, going and writing, right? Eating. So I have one client who, and he and his wife go out to dinner. He holds this for however long it takes to get there, and then when he gets there, his tremors diminish so much that he doesn't feel that he doesn't feel at risk of spilling anything or dropping anything on himself. So temporary reduction can be very, very nice. Dystonia. There are many types of dystonia. We have cervical dystonia, where you can be in like a position where your head is kind of like this. We've had very, very good luck, because this can be very painful, by the way. Cervical dystonia is oftentimes very painful. So, they'll go to their neurologist and maybe get some Botox or Botox-like stuff to help relax that. But that, usually insurance covers it once every 3 months, and it probably won't last 3 months, and plus it doesn't fix it completely anyways, right? But it can offer some relief. Well, this, along with the Botox, can offer relief too, because let's say you're contracted in this direction. Well, if you can get somebody, you don't want to do this yourself, because then it's too difficult. Get somebody to put this on you, okay? I'm doing it myself. Don't do it yourself. Get somebody to put it on you. And just relax that tight muscle, okay? And it may take a while, and actually it usually feels really good, and people generally like it a lot. And then what we'll do on the other side is do some taping, which actually I have a cervical dystonia, let's say a corrective video for that in this site as well. So look for that. You'll find it's also on the membership site too. We have cervical dystonia. What we do to relax one side that's tight, and then cue the other side to contract a little with rock tape. All right, so we have another gentleman in Denver. He had abdominal dystonia. So I just seem to remember it was like 1:30 in the afternoon that day, the second day of the workshop. It was a Sunday. The stomach started to spasm like this. And he said that about 2-3 weeks earlier, he had been diagnosed with abdominal dystonia. His neurologist diagnosed him. So we took this. He put it on medium, and he just held it here. And you can hear my voice shaking just a little bit. He held it here on the center of the area that tends to spasm. After 10 minutes of that, gone. And it didn't come back during that day. So, I mean, by 2 o'clock, it's gone. Before 2 o'clock. He left around 5:30 that day, and it had not come back at that point. Then he bought one of these, and he uses that often. Another thing, too, is we know that, remember when you start to act out your dreams, that could be one of the earliest signs of some type of movement disorder, neurological issue, Parkinson's being one of them, restless leg syndrome being one of the things that some people get or have. Well, Parkinson's or not, if you have restless legs at night and you're kicking around, and if you have somebody with you in bed, and they could actually maybe even get hurt or bruised or something because they got kicked by you. So put this on and actually just go over the legs. I mean, I don't have the camera right here, but you just go over the legs, 5-10 minutes each leg, just before you go to sleep. What we're finding is that this has helped to significantly reduce the movement of the legs at night, the involuntary movement of the legs. Okay, so last but not least, we know that we can stimulate the palm skin. We talked about that, but also on this hands and fingers thing, what I want to do is talk about what we see many times, especially a more advanced stage neurological disorder. We'll oftentimes see like the clenched hands, or maybe, I've even seen it where they're clenched so hard that the nails go into the skin and they cut the skin and there's like scabs or blood. That's another thing that they may get Botox for if they're really advanced. So as trainers, physical therapists, you can, as long as it's within your scope of practice, you have to know your local laws, your state, and all that stuff. But what we can do with this is to manually, gradually, hopefully without any pain. Because if they have pain, we don't want to be messing with it. But if we can manually get the fingers out, like a manual stretch, get this, okay? And this is another thing we have videos on here on the site. So you'll see a demonstration of this on an actual client of mine. Then get this so that eventually the whole palm is up against it, right? The whole palm. So you're going to go from this to gradually. It's going to take some time a lot of times. And of course, same thing on the other side. A lot of times one side is much more clenched than the other. Seldom have I ever seen equally clenched sides. And the client that you'll see the video of, which we'll actually put that right after this at some point, real close so you can see it. One hand just comes out easy. Her right hand is easy to get out. Left hand is very tight and clenched. All right. So, anyways, that's that. While I'm talking about that, though, there's a couple things that are like preventative things here. This will go in the, another section as well. But you can practice your extensors just by doing this, okay? That means these muscles are firing up, okay? And then you can stretch these. So you're going to go like this voluntarily. That's your extensors firing up. But when you go like this, your extensors are doing nothing. It's your flexors that you are stretching. So stretch, or use the ball on it if that's necessary. Then practice this, a finger at a time, right? Maybe put it on a surface and do it. Just lay the hands on their thighs and do it. All right? Get those extensors going. Get these things relaxed to help reduce some of that tension in the hands. And that's it for vibration therapy right now.